Notes from the school nurses. A nurse's guide for when to stay home from school. Fever. Fever is the body's way of destroying the germs, making it sick, and it's a common symptom of infections. Keep your children home if their temperature is 100 degrees Fahrenheit or higher. Wait until children are fever-free without a fever-reducing medication before letting them return to school. Diarrhea. Diarrhea is often the result of infection, food poisoning, or a side effect to medications like antibiotics. If your child is not having pain, not having diarrhea frequently, which is 2 or more in 24 hours, and can make it to the bathroom and wash hands well after using the bathroom, they can come to school. Vomiting. Vomiting is another way for the body to rid itself of the germs, making it sick. And it usually is caused by a stomach virus or stomach infection. Keep children home if they vomited twice or more in the last 24 hours. They can return to school when they are symptom-free and tolerating fluids. Sore throat. Sore throat can be a symptom of strep or a common cold. If your child has been diagnosed with strep throat, keep your child at home for at least 2 doses of antibiotics or 12 hours after starting antibiotics. If your child has a mild cold, sore throat with no fever, it is okay to go to school. Pink eye conjunctivitis. The American Academy of Pediatrics no longer recommends staying home from school for pink eye unless a child is not able to avoid touching their eye, has a fever over 100 degrees Fahrenheit, or the doctor recommends they stay home. Rashes are generally okay to attend school. You can call the school nurse to assess if you are concerned. If there is a fever with the rash, keep your child home. Scabies. They may return to school once the treatment is completed. They will still have itching and rash for several weeks. MRSA infections. They may return as long as on treatment from a doctor and any drainage from a wound can be covered. Ringworm. They can attend school. Should keep area covered by clothing or bandage. Chickenpox. They must stay home until all pox are scabbed over. Impetigo. They must stay home until lesions are treated with antibiotics for at least 24 hours or lesions are crusted over. Hand, foot, and mouth. They can attend school unless a fever is present or child is unable to maintain good hygiene or consistently drooling. Lice. We do not exclude from school. Once identified, we notify the parent, and the expectations is that they be combed out, treated, and returned to school the next day. Earaches are not contagious. There is no need to keep a child with a mild earache home. Mild cold or respiratory symptoms are no reason to keep children at home. A persistent, productive cough may be a sign of contagious conditions such as whooping cough, viral bronchitis, pneumonia, influenza, or croup, and may need medical evaluation.